Retransposition of great arteries. Now you see the chamber wise, this is left atrium, left ventricle, right atrium, right ventricle. You can see pattern foramen ovale here, flow from left atrium into right atrium. Here you see this is left ventricle and right ventricle, size wise left atrium, left ventricle and right atrium, right ventricle almost similar size. Normally we find right atrium, right ventricle enlarged compared to left atrium, left ventricle. In this case also you can say minimally enlarged because size wise almost same that of left ventricle. Right ventricle of the same size of that of left ventricle means right ventricle has got some sort of enlargement. So this is the case of detransformed great arteries. Now you can see this is left ventricle and left ventricle gives origin to pulmonary artery, and this is patent ductus arteriosus flow from aorta into pulmonary artery. So flow is again pulmonary aorta to pulmonary artery. You can see some VSD here, muscular VSD, flow is bidirectional in the VSD. This portion you see here. You can see this is a VSD portion. Flow is bidirectional in the VSD. So this is left ventricle, this is pulmonary artery, because it is bifurcating at the same time it is getting blood from aorta through patent ductus arteriosus, and this is left ventricle, this is right ventricle. This is left ventricle, this is right ventricle, this is pulmonary artery. So this is left atrium. Next image is again the fourth chamber view. This is left atrium, left ventricle, right atrium, right ventricle. Trivial tricuspid regurgitation here. This parasternal long axis view is very important because it shows you two things. When great artery arises from left ventricle, it simply goes posteriorly. So artery that arises out of left ventricle going immediately posteriorly indicates it is pulmonary artery, not the aorta. One point is very important to remember. If artery that goes immediately posteriorly coming from left ventricle must be pulmonary artery, so indicating the case of retransposition. At the same time, what you see in the beginning of great arteries, this is the great arteries, this is the great arteries, and both are parallel. So whenever you find the beginning of great arteries in the parallel, that means it is the case of transposition. Obviously in this case detransposition, because why we call it detransposition, because AV concordance, LA is connected with left ventricle, left atrium to left ventricle, right atrium to right ventricle, then you are getting this parallel arrangement, then this case comes as a detransposition. So here important point to remember is simply artery that's coming out of left ventricle immediately going posteriorly. You see this is posterior arrangement, this is interventricular septum, this line is line of axis of interventricular septum, and the artery arising and going simply posteriorly to this line, so indicating it to be pulmonary artery, and this is aorta. So aorta is coming from right ventricle and pulmonary artery is coming from left ventricle. You can see this right pulmonary artery branch also here. Again this is the aorta, aorta is coming out of right ventricle, no full obstruction, and this is pulmonary artery with patent ductus arteriosus. Now see this is pulmonary artery with PDA, it shows left ventricle, then aorta, and then now right ventricle with aorta, left ventricle pulmonary artery and right ventricle with aorta. This right ventricle aorta. I want to stop. This is left ventricle to pulmonary artery. Now this is aorta out of right ventricle. This is aorta. You can see the coronary artery here. The coronary artery is taking origin from aorta. So this must be aorta. Aorta is coming from right ventricle. So this is coronary. Whenever you find coronary arteries coming out of great artery, that means that great artery is aorta, not pulmonary artery. It is coming from right ventricle. So this is coronary artery. Moving image. So this is left ventricle to pulmonary artery. This is right ventricle to aorta. Again, the fourth chamber view. This is pulmonary artery. This is not aorta. So left ventricle to pulmonary artery, right ventricle to aorta. Simply what happens in detransfusion, blood pathway is impaired because of two arteries connected to wrong chambers in the heart. This means the one thing about the body, that means whole systemic vein drains into right atrium, then right ventricle, then aorta, then the whole body, then whole belly to right atrium through IVC and SBC and right ventricle. So this blood is not going into lungs for oxygenation. So right sided chamber is receiving deoxygenated blood. And what happens to lungs? Pulmonary veins to left atrium, to left ventricle, and then again to pulmonary artery, then lungs, that means again then lungs, then pulmonary veins, then left atrium, then left ventricle, and then again pulmonary artery. So lungs, heart, lungs, this without giving oxygen to the body. So there must be some sort of ASD, VSD and PDA. In this case we have ASD, sorry, in form of pattern from whenever you say pattern PFO, VSD and PDA, all are present. Flow wise, if you go flow wise, what we have seen, flow is from left atrium to left ventricle. Just want to show the image. See here, flow is here, the flow is mainly left to right, left atrium to right atrium, some with little bit reversal of flow. In case of atrial level, flow is mainly left to right. In case of ventricular level, flow is bidirectional. In case of PDA level, pattern ductus arteriosus level, what is of PDA level? In case of PDA level, what you see? Flow is mainly aorta to pulmonary artery, but as the aorta and pulmonary artery is already reversed, so flow is mainly along mixing. Flow is going oxygenated side to deoxygenated side at the level. Simply, this is oxygenated. This is oxygenated side. This is deoxygenated side. So oxygenated side to deoxygenated side. Here both right to left, left to right. So here equal. In case of PDA, it is opposite. What is opposite thing? In case of PDA, what is opposite thing? It is going from deoxygenated side to oxygenated side, because aorta is containing deoxygenated blood and pulmonary artery is containing oxygenated blood. So everything is along mixing, proper mixing, and that is why the child is surviving. The child will not survive long without a corrective surgery. So there must be mixes. Whenever you find a detransposition, there must be some sort of ASD, BSD and PDA, either ASD, BSD or ASD and PDA or BSD and PDA. There is some sort of mixing must be present for child to survive. That is the point to know in this case. There must be some sort of, because body, heart, body without being rooted to lungs for oxygenation, or lungs, heart, lungs, that is left atrium, left ventricle and pulmonary artery, pulmonary veins left atrium, left ventricle, and then pulmonary artery without delivering oxygen to the body. There must be some sort of mixing. So this is the case of detransposition of gate arteries. How to identify detransposition? Parasternal long axis view. You see the gate artery that is coming out of left ventricle is immediately going posteriorly, indicating pulmonary artery. At the same time, the beginning of gate arteries are parallel in arrangement, indicating transposition of gate arteries. In the apical four chamber view, this is left atrium, left ventricle. So there is AV concordance. You can see the tricuspid body is more apically situated, closer to apex compared to mitral valve. You can see this moderator band is also there in the right ventricle. So there is AV concordance, that is quite clear. So AV concordance, VA discordance, detransposition, AV discordance and again the VA discordance, then that will be L transposition. Thank you.